Hello, and welcome to our coding snapshot on fractures. Get out your I-10CM coding manual and let's turn to your chapter-specific coding guidelines. When you're coding fractures, the fractures are either going to be traumatic or pathological. For traumatic fractures, it's an acute or current injury, and this can occur to some type of trauma. Maybe the patient was involved in a motor vehicle accident. Maybe there was a fall where they sustained some type of injury. So if you're coding traumatic fractures, you're going to want to go to Chapter 19, Injury, Poisoning, and External Causes. And the code range for this is S00 through T88. The second type of fracture type are pathological fractures. These are caused by disease. If you're coding pathological fractures, you want to be sure that you go to Chapter 13, Disease of Musculoskeletal and Connective Tissue. And these codes are going to be M00 through M99. And examples of pathological fractures caused by disease are those caused by neoplasms, or the patient may have osteoporosis. When you're coding fractures, you want to keep in mind this. The fracture is either going to be a closed fracture or an open fracture. A closed fracture is one where there's no open wound, and the physician might refer to a closed fracture as suppressed, green stick, or a simple fracture. Then you have an open fracture, or there's an open wound, and you actually might see the bone protrude through the skin. The physician can refer to this as a missile fracture, puncture, or compound fracture. Your Chapter 19 coding guidelines indicate that a fracture not indicated as open or closed should be coded to close. A fracture not indicated whether it's displaced or non-displaced should be coded to displace. If a fracture is displaced, it means the bone has cracked and the pieces are separated. So in other words, the bone breaks and it moves so the two ends are not lined up. In a non-displaced fracture, you have partial damage to the bone, and that damage is limited to a crack. Let's look at this example. The patient sustains a lateral malleus of the left fibula 6 weeks previously and is admitted for removal of the pins under anesthesia. So you want to ask yourself, when you're coding the fracture, is this a pathological or a traumatic fracture? Where is the fracture site? What is the laterality? Laterality in fractures means left or right. Which seventh character is assigned? Let's take a closer look at this coding snapshot. I've highlighted here some key terms. Left fibula, okay, that indicates our bone. The physician describes this as the bone break occurred at the lateral malleus. Now let's look at our questions. Is this a pathological or traumatic fracture where there's no indication by this case that any type of disease process has occurred? So this would be a traumatic fracture. We know the fracture site is the fibula. Laterality is on the left, and our seventh character sign is D. Let's look a little bit closer. Go to your alphabetical index and look up our main term, fracture. We know it's traumatic, so fracture and traumatic. We want to scroll down to the fracture site, fibula. When you get to the fibula, it says shaft and styloid in parentheses. Again, terms in parentheses are non-essential modifiers, and they're not going to affect code assignment. What you see here is code S82.40-, and you see a check mark. This indicates to you when you go to the tabular list, you're going to have to assign additional characters in order to complete this code to the highest level of specificity. We know where the fracture site occurred, lateral malleus. So we look at our indented term here, and it says lateral malleus, and it has displace, code S82.6 and a dash and a check mark. So now let's go to our tabular list and look at this closely. So when we go to S82.6, what we see there to the left, we see a box, and it says check, an X, and seventh character. This indicates to us that this fracture code requires 7 characters. So we're going to go to our main category, which is S82. So flip all the way back to category S82, and what you'll see there is a box that says the appropriate 7th character is added to all codes from category S82. Then you see a list of 7 characters. In our particular case, we're going to assign D subsequent encounter for a closed fracture with routine healing. Because this injury occurred 6 weeks ago and the patient is still under care and they're only being admitted for removal of the pins. So the correct code is S82.62XD. I hope you have found this coding snapshot on fractures helpful.